Happy morning, everyone. This is Dr. Abarna from Department of Microbiology. Today's topic for our discussion is infection control practices. So, as we all know, prevention is better than cure, right? So, prevention is always the key. As healthcare workers, we are always exposed to a lot of communicable diseases every day. So, knowledge about these diseases, about their transmission, how to prevent them, will keep us healthy anytime. So before going into the infection control practices, we need to know what are the healthcare associated infection that can occur in the hospital premises. So we can classify this HAI into many types. The first one is being pneumonia. So this pneumonia patient can acquire from prolonged assisted ventilation. We can call it as ventilator associated pneumonia. And the second one is urinary tract infections. So some patients, they are bedridden for a long time and or with many other complications. So in such patients, they will be catheterized. So as a healthcare associated infection, they will acquire UTI. So such infections are called as catheter associated urinary tract infection, that is COTI. The next type of infection is bloodstream infection. So certain patients will be accessed with central access to the bloodstream. So they will be having some jugular line to access the central line. So such patient will acquire the bloodstream infection and they will be suffering from septicemia. So such infections are known as CLABSI or central line associated bloodstream infections. And the most common one is surgical site infection. So it occurs post-operatively, and most commonly patient will suffer from surgical site infection if appropriate post-operative care is not given. Apart from these four things, there are many other infections which includes multi-drug resistant organism also. So how we can protect ourselves and our patient from all such hospital acquired infection? It's only in our hands. We'll see how. So when we follow all these infection control practices strictly, we can very well prevent the occurrence of all these hospital acquired infections. So under infection control practices, what are all the headings we are going to cover today is universal precautions. We'll see what is universal precaution. It includes hand washing, barrier precautions, sharp disposal, and handling of contaminated materials. Apart from following these universal precautions, we do have to concentrate on prophylactic immunization to prevent us from getting a lot of infections. And the most important thing is biomedical waste disposal and management. So we'll see one by one. First one is universal precautions. They are nothing but some control guidelines designed to protect the healthcare workers from exposure to diseases spread by blood or other body fluids. So this is nothing but you have to protect yourself and thereby you are protecting your patients too. So what are the universal precautions? It's very impossible to identify a person whether he is infected with HIV or not. If suppose a patient is HIV positive, we'll take utmost care to prevent the infection transmission from them, right? But if suppose the patient is unidentified, okay, he's not been tested, so what we will do? We will never come to know that he is infected, right? So in such cases, what we can do? We should treat all the blood, body fluid, broken skin and mucous membrane as if they were infected with HIV. So that only we will follow all the necessary precautions. Okay. We cannot tell anyone looking at them whether they are infectious or not. So what are all the universal precautions we can observe in those patients? Not only in particular patients, we will consider all the patient as infected only. Then only we'll observe all these universal precautions. So the first and foremost one being the hand washing. So this is the best way to prevent the infection transmission. We can break the chain of transmission only with the help of hand washing. So why it is given so much stress? Why do we need to learn about hand hygiene? So these are some culture plates grown from the hands. Okay, you can observe a lot of organisms, microorganisms grown on the culture plates, right? So we know very well our hand is a germ farm. It contains a lot of normal flora. The normal flora being a normal habitat in one person, can become an opportunistic pathogen in an immunocompromised patient. So that you should cut down all these germ farm before touching any patient. So when do we wash the hands? So we need to observe these 5 moments for hand hygiene. So what are those 5 moments? First one is before touching a patient, before doing any procedure or any invasive procedures, and after doing the procedure or body fluid exposure, after touching the patient and after touching the patient's surroundings too. So remember, you should wash your hands or rub your hands with the sanitizer before touching the patient and after touching the patient, before doing any procedure and after doing any procedure. And finally, when you're going to leave the patient environment also, you should decontaminate your hands. So how do you wash? You should wash with soap and water, scrub your hands and wrists for at least 15 seconds. This is simple hand washing. So when using alcohol products, apply to all areas of hands and wrist and allow to dry. At least for 15 seconds, you should do this. And while doing this, what we will do, we will miss out certain areas which is not routinely covered on general hand washing. So these are the most often missed areas like your thumb, tips of the fingers, web spaces, and center of the palm. Okay, most often we will miss out these areas. So to cover these areas, what we can do, we can follow this steps in hand washing. So what we have to do, you should remember all these 7 steps for hand washing. First one, you should wet your hands, get some liquid soap, rub your palms together, then rub the back of both hands. The third step is interlace your fingers and rub hands together so that your web spaces are clean now, right? And then the fourth step, interlock your fingers and rub the back of fingers of both hands, which cleans your tips of the fingers and back of the nails. And then rub the thumb in a rotatory manner, followed by the area between index finger and the thumb for both hands. So this cleans your thumb. And the last 6th step is rub the fingertips on palm of both hands. So this cleans your center of the palm and the fingers tips. And finally, you rub both wrists in a rotatory manner, rinse and dry thoroughly so that you're covering your wrist also. So these steps will cover all the hidden areas in the hand. Okay, so you should follow all these 7 steps for hand washing. So after rubbing all those things, rinse it and wipe dry. So you should remember this hand washing step forever. So this is the main key in breaking the infection transmission. And the other things which you can follow to prevent infection transmission is barrier precautions. It includes wearing of gloves, masks, caps, eye goggles, impervious gowns, and footwear. So regarding gloves, sterile gloves are used for invasive procedures. You know that very well. So your gloves must be of good quality, suitable size, otherwise it will be tear, and that should be of good material also. And never ever reuse the disposable gloves. And do remember, wash your hands before and after wearing gloves. Do not touch any clean objects with contaminated gloves. Regarding your mask, cap, and eye goggles, if there are procedures likely to generate droplets, you need to use this cap, eye goggles, and mask, right? During surgeries, to protect the wound from healthcare workers, normal flora also, we use these accessories. And it also protects us from splashing of fluids. And this is very, very important. Wearing of footwear inside the hospital premises is very, very important because we may have a lot of cracks on our own feet. So what do we do? Most of the times inside the OTs and ICUs, we will leave our slippers and walk away with barefoot, right? But those are the areas which can be contaminated with a lot of microorganisms. So in those areas, through your cracks, any organisms can enter your feet. So to protect it, don't walk barefooted inside the hospital premises. Cover your foot anytime, everywhere. And use of impervious gown to protect yourself from spraying or spattering of blood or body fluids. So it must be waterproof. A sterile linen or disposable ones are used for sterile procedures. So that's all about the barrier precautions. And the next one, apart from the universal precaution, the next one is prophylactic immunization. So you have to protect yourself from being infected with the bloodborne viruses like HBV, HCV, HTV, and HIV by safe handling of needles. We will try to acquire this type of infection only during needle stick injuries. So the percentage, the proportion of infection acquiring is 1 in 3% in case of hepatitis B infection, and 1 in 30 patients in case of hepatitis C infection, and 1 in 300 needle stick injuries of HIV patients. So we are worried much about this hepatitis B, right? 1 in 3 patient can acquire the infection. So what we need to do, we have to protect ourselves from hepatitis B by giving prophylactic immunization, that is vaccination, right? And we need to know about this sharp precautions too. So never ever recap the needle so that accidentally you can prick yourselves. So don't try to break, bend, or resheath or reuse syringes or needles. So they will be exposing you to needle stick injuries. So always use needle cutters to destroy the needles. Sharp injuries must be reported immediately to your superiors and it should be notified. If suppose even you are more cautious, we many times we can get some accidental exposure to bloodborne pathogens. Some splashes we may get, or sometimes we may get a accidental needle stick injury also. So what next? Don't be panic. Okay, never be panic. Wash the needle stick injuries with soap and water. If any splashes are there, flush with the water. If it is exposed to nose, mouth, or skin, wherever it is exposed, wash with water. Irrigate your eyes with the clean water, saline or sterile irrigants. Report this incident to your immediate supervisor and immediately seek the medical advice. So immediately they will assess the status of the source and the exposed, and accordingly they will initiate the investigations and they will start the post-exposure prophylaxis immediately. So starting your PEP for HIV within 2 hours, it's very much important in case of HIV transmission. So don't skip your needle stick injuries. Immediately report to your seniors. And the other important thing you have to concentrate in infection control is spillage of blood and body fluids. So this is a common health hazard in the working environment. Never wipe the spillage with working wet mop. Okay, there is a way to clean this spillage of blood and body fluids. So what we have to do, we have to instruct the housekeeping to wear clean gloves, use the appropriate disinfectant for appropriate contact time. So you take bleaching powder, pour over it, or keep a paper towel, that is tissue paper over the spillage, pour the bleaching powder over it, wipe up the cleaning from outside to inside so that you're containing the infection, right? From cleanest part to the dirtiest part, you contain the infection, and then never pick up the glass even with the gloves hand. Just take it with the cardboards or plastic items and dispose it in the yellow bags. After cleaning everything, dispose of the gloves and cleaning equipment. So for large spills, you can use undiluted bleach from the bottle. For small spills, you can dilute into 10%. For general surface cleaning, you can use 1% of bleach. So this bleach is a superman in cleaning all the equipments. Bleach is nothing but sodium hypochlorite. So we discussed about this vaccination, right? So this vaccination is 3 doses for hepatitis B infection. It can start from 0, 1, and 6 months. So definitely each healthcare worker should be vaccinated with all these 3 doses. The last one to discuss about is the biomedical waste. You can see the picture. These are all the biomedical waste which are generated during the process of diagnosis, investigation, treatment, and vaccination. So all those things which are generated during this process in a hospital is known as biomedical waste. Be clear in one thing, only these things are biomedical waste. Though some paper waste and kitchen waste are generated in the hospital, they are not biomedical waste. So those things, any solid or liquid waste which are generated only during the diagnosis, treatment, or immunization of human beings or animals are termed as biomedical waste. So when you see in a hospital, we will generate lot of waste in a day, right? 85% are infectious. That I told you, lot of paper waste will be there, kitchen waste will be there. So those comprises this 85%, but only 10% are infectious. As I showed you in the picture, no, some syringes, needles, and then gauze pieces, linen, soiled linen. Okay, so those things comes under only 10%, and 5 are hazardous chemicals. So we are very clear that the majority of the waste are only non-infectious. So this 80% non-infectious waste can be sent to the municipal for routine management and disposal. So when you're mixing these 15% infectious waste to this 85%, so everything becomes contaminated. So what do we need to do? We have to segregate at the point of generation, so that only we can easily dispose this 15%. Otherwise, we have to worry about all the 100% waste as a biomedical waste. Otherwise, only 85% waste we'll send to municipality, and only we'll concentrate about this 10 to 15%. So because of this exposure to the biomedical waste, there are a lot of hazardous effects to the healthcare workers and the environment or to the society also. So we are exposed to a lot of bloodborne infections like HIV, HBV, HCV, lot of injuries we can go through, and many bacterial infections like cholera, salmonellosis, anthrax, TB, even rabies, right? And patients and the society people are exposed to some radioactive waste, and they will have some cancers, genetic mutation, and birth defect. Some chemical waste can even cause poisoning, dermatitis, conjunctivitis, and bronchitis. So in order to prevent all these health hazards, we need to segregate this biomedical waste and dispose it appropriately with appropriate measures. So for that purpose, we are categorizing this biomedical waste into 8 different categories. One is human anatomical waste. Second one is categories 2 is animal waste. Category 3 is microbiology and biotechnology waste. Category 4 is sharp waste. And 5 one is discarded medicine and cytotoxic drugs. 6th one is soiled waste. And 7th one is infectious solid waste. And 8th one is chemical waste. So with all these things, we do have some color coding of bags. Okay, we will have 4 different types of bags. One is yellow, then another one is red and blue. So in this picture, I have given what color you have to use for which waste. So you can observe that for yellow bags, all your anatomical waste, animal waste, discarded medicine, cytotoxic drugs, and soiled waste, whichever things soiled with blood or body fluids. So all these 4 categories will go into the yellow bag. And whichever is going into the yellow bag, ultimately they will be incinerated. That means they will be burned down into ashes. So you remember only 4 things: human anatomical waste, animal waste, discarded medicines and cytotoxic drugs, soiled waste. All these things will go into yellow bag, and those into the yellow bags will be incinerated straight away. And when you observe this red color bin will receive the infected plastics and rubbers. So when you observe the microbiology, biotechnology waste, sharp waste, and infectious solid waste. So infectious plastic and rubber items, they will go into the red bag, and those things within the red bag, they will be autoclaved, that is disinfected, and they will be taken sometimes for recycling also. So certain plastics and rubbers, you can disinfect it and give for recycling. So this is a list of materials which can be thrown into the yellow bags. Human and animal tissue organs, body parts, animal carcasses, any non-plastic soil waste, cotton dressings, linen beddings, soil plaster casts, soil paper, removed sutures, and discarded drugs. So you can see this, all 4 types into the yellow bag. And you know very well, for red bag, sharps, plastics and rubbers. So into the black bin, you can pour every kitchen waste and paper waste. And there are some biomedical waste management do's and don'ts. You need to remember these do's and don'ts for appropriate segregation and disposal of biomedical waste. So segregate these waste at the point of generation. That is very, very important because we can prevent the contamination of the general waste also. So mutilate the needles and plastic waste as soon as it is generated. And you should have a biohazard label on the red, yellow, blue bins. Do not generate any unnecessary waste. Never mix infectious or non-infectious waste. Never ever overfill the bins and never store these waste beyond 48 hours. Avoid transport of waste through crowded areas and within wards. Avoid spillage during transport. And we should remember this, that the waste of the sick not contaminate the lives of the healthy. The disinfectants do not replace universal precautions and good hygiene, right? So you should always keep in mind that prevention is better than cure. So remember yourselves, please do not come to volunteer if you're sick, especially if you have fever, rash, nausea, vomiting or diarrhea. This is for the sake of yourself and for the protection of your patients too. Cover your cough, stay up to date on vaccines, and always remember hand washing and hand washing. And we'll end up the class with the wordings from William Osler. Soap, water, and common sense are still be the best antiseptics. You need to know where to wash. So that is your common sense, right? So all these three things will be the best antiseptics even today. So we will agree that hospital infection control, it's in our hands only. Thank you.